Do you find your gums bleeding when brushing or flossing your teeth? You might think it's normal, but you're probably seeing one of the signs of gum inflammation or gingivitis. If left untreated, the infection can travel below your gum line and into your bone that supports your teeth. The condition is known as periodontitis, a gum disease which is largely preventable. The biggest culprit behind gingivitis and periodontitis is plaque. I'm Dr. Freddy Gomez. This is MedTalk Health Talk on CNN Philippines. We bring you the knowledge and care you need, especially in this time of COVID-19. Gingivitis is common, but it's preventable. If not treated early, it can result into more serious problems. To join us with today's discussion, let's welcome Dr. Yvonne Vanessa Chua. She's a periodontist and the past president of the Philippine Society of Periodontology. Also with us is Dr. Evelyn Xiao. She's a family medicine specialist and training officer at Tondo General Hospital. Now, dental hygiene is the practice of keeping your mouth, teeth, and gums clean and healthy to prevent disease. And we'd like to go over dental care before we talk about gingivitis as well as periodontitis. I'll start first with Dr. Xiao. A lot of our viewers are very familiar. They've been taught this even as children to brush their teeth every day to keep their teeth clean. But is brushing the be-all and end-all? Enough ba ito para maging malinis ang ating bibig at ipin?
As a family medicine specialist, so we really focus on preventive health care. So we have to identify health risk behaviors of an individual and then encourage them to stop this. So like stopping smoking, drinking alcohol, eating sugary food. And then we encourage also to focus on the proper oral hygiene.
Now, the way you brush your teeth is important as well, and doing a poor job at brushing your teeth is almost as bad as not brushing at all. So, Dr. Yvonne, how do we properly brush our teeth?
All individuals will have their own proper technique that has to be applied. So we're talking about gingivitis, which is a superficial form of the condition. Then some strokes may have to be deeper than usual and angled so that they can reach further the depth of all of those inflamed tissues.
Before we get into those with specific gum disease, how is an effective way to brush? Ano bang time frame dapat dito? Marami kasing ang nagsisipilyo, wala pang 20 seconds, tapos na sila.
The usual that's being done by individuals is a scrubbing technique. So kung scrubbing, you're doing it within 3-5 minutes, okay, per section, okay. And then you also have to include your tongue, your palate, your other soft tissues, just so you get a general full clean while you're brushing your teeth.
Now, Dr. Xiao, please tell us more about the benefits of having good oral hygiene as it pertains to someone's overall health.
Remember that the mouth is an entry point going to the digestive tract and our respiratory tract. So bacteria can actually enter our body through our mouth. So if we have a good oral health, then it may signify a good overall body also.
Dr. Yvonne, how often do our viewers need to see a dentist for regular checkups? And what is it that needs to be done and examined carefully during these checkups?
Oftentimes, you regularly hear from your dentist, I'll see you twice a year. Whenever a patient presents to the clinic for cleaning, first and foremost is a health check orally. No? So what we do, commonly dentists will focus themselves on looking for decayed teeth. But with periodontists, we include gum health with the oral health check alongside health questionnaires that the patient has to fill out.
But every so often, a dentist may recommend a deep clean, which is something that is done at the dentist's office, of course. Could you explain to our viewers what the benefits of or what exactly is a deep teeth clean?
We actually use an instrument we call a probe. And this probe, a periodontal probe, is actually calibrated in millimeters. So when we insert this into the gum crevice, so we're actually measuring that height of tissue going down if there is a depth beyond 3 millimeters within the calibration. Once it becomes deeper, it's a distinguishing factor already that we're looking at something more advanced where bone loss is involved, which is what we call periodontitis.
Did you know that improper oral hygiene can lead to tooth loss? More on this when we come back. We're together in health here on Med Talk Health Talk. Stay with us. Gingivitis is an inflammation of the gums, and if left untreated, it can turn into a more serious infection called periodontitis. I'm Dr. Freddy Gomez, and you're watching Med Talk Health Talk on CNN Philippines, where your care comes first. Gingivitis usually happens before periodontitis, and plaque is the culprit behind the two. Now, Dr. Yvonne, let's explain these two conditions, gingivitis, periodontitis. What should our viewers know about these?
When you say gingivitis, the most visual thing that the patient can actually see is gum bleeding. Okay, there is no pain involved with this. That's why sometimes they brush it aside. Okay, the bleeding will go away, but with the unattended removal of the plaque biofilm, then you have certain kinds of bacterial aggregation that actually conforms to producing more inflammatory cases and makes it progressive. When it progresses now, then it involves your bone loss, which is the condition of periodontal disease.
Are there any risk factors, Dr. Yvonne, when it comes to having gingivitis and its progression towards, or that can make the progression faster towards periodontitis?
Gingivitis is common with everyone, in the young, in the old. Periodontitis is more common in the elderly because that's when the age of comorbidities come about, right? So any chronic inflammatory process within your body complements what is happening chronically in the mouth as well. That's where the mouth-body connection comes about. So with your periodontal disease being more common in the elderly, other risk factors that come about is smoking, which is very, very common as well in our society. Smoking just gives that, lends that vascular fragility for our blood vessel walls and then increases permeability.
Dr. Xiao, since we're talking about conditions ng gums, one of a very common condition pagdating sa gums ng tao ay ang singaw or aphthous ulcers. What can having aphthous ulcers, which is very uncomfortable, lalo na kapag nagsisipilyo at natatamaan siya, no? What can this signify, especially when it comes to our immune system?
We have to look also into the overall stature of the patient. Yung edad niya, the age, what are the different comorbidities of the patient. Everything adds up to how we go about with the gum bleeding of the patient.
Okay, can some medications, Dr. Evelyn, can some medications actually also affect the condition or the current state ng gums?
There are certain medications that are being taken by the patient which can suggest or it can increase the risk of the patient to be having gum diseases. For example, those patients who are into an anti-epilepsy drug, which are like your phenytoin, other medications like those immunosuppressants, and other antihypertensives which can cause gingival hyperplasia. So parang kumakapal yung ating gilagid or the gums.
Now, Dr. Yvonne, let's talk about some of the signs that our viewers need to watch out for that signify that they may have a gum inflammation or even gum disease. Let's talk about some of the clear signs na pwedeng ma-experience na ating mga viewers.
So when you have bleeding, you are in a state of inflammation already. So yung pamamaga ng gilagid, sometimes that comes late into the picture, no? Pero meron kasing yung complaint na, Dok, bakit nangangamatis yung gilagid ko? That's a very common description that I hear from patients. And when you have these, bleeding, redness, swelling, and all, malodors come about. So bad breath is coming into play already. So with that bad breath, then they actually present themselves to the dental office for cleaning.
Gum disease is common is that of the older age group, which they may have dentures. How can ill-fitting dentures affect the overall health of someone's gums?
Well, long-time denture wearers, especially those that are the tissue side of the denture, there's going to be some form of friction. Friction when you have loose-fitting dentures already and you've not gone to your dentist for a quick repair or reline of your denture, then that friction leads to conditions that's called epilis. So, na-irritate yung gum tissues underneath the dentures.
Plaque is the primary cause of gum disease, but there are other factors that can contribute to this as well. But Dr. Yvonne, could you expound on that as well? Ano pa ba yung ibang mga factors that can contribute to gum disease?
The main etiologic factor, the main cause really is bacteria. And how that bacteria, the ecology of bacteria actually presents itself in the mouth for a long period of time. So if you have now a very mature plaque biofilm that is left undisturbed, then it becomes, a risk factor already for developing periodontal disease.
Dr. Yvonne, how is gum disease diagnosed? How can you arrive at a definitive diagnosis of the gum disease?
Earlier, we mentioned we were talking about the instrument that we use to measure the depth, right? Because when we measure depths, we're looking at the root surface of the teeth and how much of that root length is actually still within bone. So if periodontitis feature is losing bone, we need to know how much bone has been lost so that we can determine, am I going to lose this tooth eventually, or can I still save this tooth for the patient to promote functional longevity for the dentition?
My question now is for Dr. Xiao. Dr. Xiao, can gum disease manifest kapag ang isang tao ay may ibang karamdaman sa katawan?
The patient has diabetes, the patient suffered from a recent stroke, or there are other cardiovascular illness. So the immune system is low, so the patient will have more episodes of gum diseases. No? So the chances of the gum diseases to be seen is increased because of the risk factors of the individual.
Dr. Yvonne, how is this approach done? What is the initial treatment for someone diagnosed with gum disease?
So for gingivitis, you have a more superficial depth to clean out. So if it's superficial, sometimes it does not involve anymore the administration of local anesthetics. But as you go deeper, then pain can be a problem while doing the procedure. Then we have to administer those local anesthetics.
Gum disease doesn't only affect your oral health, but your overall health as well. More on this when we come back. You're watching Med Talk Health Talk, where your health is our mission. The state of your teeth affects your overall health, and gum disease is linked to lots of health problems in other parts of the body. I'm Dr. Freddy Gomez, and this is Med Talk Health Talk on CNN Philippines. We're your connection to healthcare. Dr. Yvonne, how is having gum disease related to our overall health?
The basic premise actually is inflammation. If you can hold off acute inflammations, chronic inflammations especially, then you get a better oral health and systemic health. So when you have that equilibrium between your mouth and your body systems, then you have that healthy oral health and body connections.
Dr. Xiao, although not everyone who has heart disease has gum disease and vice versa, there are some studies that point out a correlation between the two. Can you explain this so our viewers may have an idea on how these separate diseases may be connected?
It can increase the chance of an individual to have a bacterial overgrowth, which may have the possibility to enter into the bloodstream. So specifically for those individuals who have artificial valves, so you have a bacterial overgrowth, pwede tayong magkaroon eventually ng endocarditis. So another is what was mentioned by Dr. Chua a while ago, the theory of inflammation and infection. So there are theories that chronic inflammation can eventually cause the clogged arteries and eventually lead into some other cardiovascular illness.
So anong mga pagkain ang usually nagpapalala ng ganitong situation ng gingivitis, periodontitis?
Everyone is actually into that diet where carbohydrates are being lessened. That's actually a good start, actually. When you lower your carbohydrate intake, especially yung mga simple sugars ninyo, your sucrose, your glucose, and everything, candies and sweets. Meron naman good carbohydrates that we can add into our diets. Those that are rich in fiber, right? Of course, the higher the fiber, the better for as a low glycemic index, actually.
Can gum disease at this level affect children as well as it does adults?
Yes, it can. Actually, according to the National Oral Health Survey, I think this was in 2006 or 2008, the actual age where gingivitis is prevalent already in the young is at as early as 12 years old. So when these children don't have access to a cleaning or a dental office for a health check or a cleaning, then this gingivitis just proceeds to progress. And then by the time they reach their early 20s, medyo moderate, maybe severe na rin yung gum infection nila na pwedeng may bone loss na, which is periodontitis already.
Now, Dr. Xiao, quick question. When it comes to oral health, ang mga taong madalas magka-tonsillitis for this matter, does this have any connection with their possibility of having gum disease?
If you have our oral health dahil you don't brush your teeth regularly, you don't floss, and ganyan. So there is an increase in the bacteria in the mouth. So yung paulit-ulit na tonsillopharyngitis, of course, eventually magkakaroon ng overgrowth of bacteria in the oral cavity.
And we're glad you joined us on Med Talk Health Talk. Thank you, periodontist Dr. Yvonne Vanessa Chua and family medicine specialist Dr. Evelyn Xiao. We appreciate your time and expertise very much. Now, when it comes to good oral health, it's not always about how white your teeth are or how bright your smile is. Your gums are very important as well. And since gum disease is usually painless, most people have no idea that something's wrong. Proper oral care not only keeps your mouth healthy, but your overall health as well. We hope today's discussion helps you take better care of your teeth and gums. I'm Dr. Freddy Gomez. This is Med Talk Health Talk on CNN Philippines. Our mission is for better health for you and your loved ones.